Hello everyone, this is Dr. Abinaya Vijayakumar. I am a doctor and a motherhood empowerment coach. For those of you watching me for the first time, I take positive pregnancy classes to pregnant women where I teach them to stay confident and happy throughout their pregnancy and also to connect with their baby through simplified Garb Sanskar techniques. For more details, connect with me through Instagram or Gmail. I'll provide links for both in the description. Kindly check it out. Today in this video, we are going to discuss about who is this high-risk mother. What are all the high risk we are talking about in pregnancy. You will understand why is it so important and what care has to be done for those who are in high-risk category. Let's get started. So let us start with the basic parameters. The pregnancy in which the woman's weight is less than 45 kgs, we call it as underweight pregnancy. With respect to height, a woman who is less than 145 centimeters is considered as short pregnancy. The next parameter is the age. The age of the women in first pregnancy. The age of the women in with respect to, let's consider the next factor, which is age. The age of the pregnant women less than 19 years or more than 35 years in their first pregnancy is considered to be high risk. We saw the basic measurements of height, weight, age. Next is the weight gain during pregnancy. If a woman gains more than 3 kgs in a single month, that is also a high risk in pregnancy. We say the weight gain in the entire pregnancy is 10 to 15 kgs, but this does not apply to every mother. For example, a woman who is almost 55 to 60 kgs in pre-pregnant phase is allowed a weight gain of 10 to 15 kgs in the entire pregnancy phase. But this is not applicable for the women who is already on the overweight side, where the woman's weight is more than 80 kgs or 90 kgs in the pre-pregnant phase. So any excessive weight gain has to be taken care of and has to be consulted with your doctor in order to prevent any complications because of the excessive weight gain. So the next criteria is with respect to the previous pregnancies. First is the high order pregnancy. High order pregnancy is the term what we use if the pregnant mother is conceived for third or fourth time. So anywhere more than 2 times we call it as high order birth. Next is number of live child. How many deliveries did she have? If she already has 2 live child, which means this is the third delivery, it is a high risk for her. Next is prolonged labor or retained placenta. If the woman says that she had a long labor for 2 days, 3 days, and she also had complications where the placenta was stuck inside and she had to undergo some procedure to take it out, that is considered as high risk pregnancy. And if the mother gives history of twin pregnancy or triplet pregnancy earlier, that is also considered as high risk pregnancy. The next criteria is how is the previous child doing? For example, if there is any history of stillborn child or intrauterine death where the child is already dead inside and then it was delivered, these are also considered as high risk pregnancy at present. Because if she has previous history like that, we have to make sure that we do everything to prevent such complications in this existing pregnancy. Next is her medical history related to pregnancy. For example, if she says that she has history of increased blood pressure during her previous pregnancy, or her sugar levels were high and she was under medications for hypertension or diabetes, which we call as pregnancy induced hypertension or gestational diabetes, if the woman says such history, she is a high risk candidate of this pregnancy. If the pregnant woman had any history of seizures, that is fits, during the earlier pregnancy, she is also considered as high risk during this pregnancy. Or if the hemoglobin of the woman was very low, like less than 8 or less than 7 in the previous pregnancy, and she was given too much of iron sucrose infusion or blood transfusion, that is also considered as high risk. And we need to make sure that we maintain the optimum hemoglobin throughout the pregnancy, starting from the beginning till the end, so that the mother doesn't land up in any complications because of anemia. If the pregnant mother gives history of molar pregnancy, which is not actually a pregnancy but it is like a bunch of grape-like structure, then she has to be monitored closely in this pregnancy. Next is with regards to the amniotic fluid index. If the woman in the present pregnancy is having AFI of more than 16 centimeters, which we call as polyhydramnios, or if the AFI is less than 9 centimeter, which we call it as oligohydramnios, this woman has to be in close watch. Next, if the woman gives history of repeated miscarriages like early pregnancy losses or pregnancy loss in 5th month or 6th month where incompetent cervix can be a reason, this woman has to be closely monitored and her cervical length has to be monitored. She can be given progesterone supplements as well as heparin injections to prevent such complications during this pregnancy. If needed, she would also be advised cervical encerclage, which is stitching of the cervix during this pregnancy. Last but not the least, Antepartum hemorrhage, APH. This is nothing but bleeding during pregnancy. Anytime if the mother bleeds during the pregnancy, she has to be immediately subjected to ultrasound scan to check for the fetal heartbeat if there is any blood collection or bleeding in the placental region, to make sure that there is no risk for the mother and the child. And also we have to make sure that the cervical os is closed throughout the pregnancy whenever there is a bleeding, because when the cervical os is open and there is bleeding, there is a high chance that it can lead to termination of pregnancy. If you are fitting in any of these criteria that I have mentioned earlier, then you may be a high risk mother. It is high time that you are under close watch of your gynecologist and you follow all the instructions given by them. This video is not to alarm you but to make you aware of where you are standing in your pregnancy. So when you understand that you are in a high risk position, you need to do everything that you can along with your doctor so that we give our best shot for the continuation of pregnancy till term and for the well-being of the baby. I hope you found this video useful. Do comment your doubts in the comment section. I'll read each one of them and respond to it at the earliest. If you like this video, do like, share and subscribe to my channel and press on that notification bell icon so that you don't miss out on any new videos in my channel. Until I meet you in the next video, stay happy, stay mommified.